Hi everybody, welcome to Healthline. I'm Gregory Zarian. Okay, so summer's in full speed. Are you outside? Are you playing in the sun? Are you at the beach? Do you have your sunscreen on? Are you drinking lots of water? Are you eating healthy? And most important, are you spending time with your family and your friends? We at Healthline always remind you to put down the phone, turn off the TV, and get involved with the ones around you. So go for a walk with your family. Go outside, play with the dog, breathe in and breathe out. And it was also the 4th of July. I hope it was a great one, and I hope it was safe and healthy. So the topic today, it's all about your mental health. It's about behavioral health, and it's about treatments. Joining us today is Dr. Lucas Alexanian, psychiatrist, and Scott Robertson, the Director of Behavioral Health and Recovery at Glendale Adventist Medical Center. Gentlemen, welcome.
Thank you, Greg.
What got you involved in the conversation of mental health and behavioral health, doctor?
Well, first I got involved being a doctor, and then I decided that probably psychiatry is the easiest place for me to go. Joking about it, of course, but doing the residency and knowing psychiatric patients and knowing that probably any physician, particularly primary care physicians, see more psychiatric patients than not, even though they might not recognize or patient might not necessarily communicate about that.
Because they're basic signs and symptoms. They'll say, oh, I'm not feeling good, I'm depressed, I'm not happy.
Right.
So most doctors, as you just said, are pretty much psychiatrists to some level.
Well, at least they're trying to be one, because oftentimes they get patients that have a lot of complaints and psychiatric issues that they have to handle.
And Scott, what got you involved?
Well, Greg, maybe like a lot of people who are watching, family problems. You know, I grew up in a family where mental illness and substance use disorders were part of our experience, and I began recovering myself when I was 16, and I've been in recovery continuously since I was 24.
So for people that don't know, what does recovery mean?
Well, recovery is when a person with a condition, typically addictions we're talking about, or substance use disorders, makes a decision to change their behavior in a systematic way. And so to be in recovery would mean, for me, that I'm abstinent from drugs and alcohol, and have been for a little over 30 years.
Congratulations.
Thank you.
Congratulations.
And so, you know, in one of my meetings, a fellow who worked in a hospital said, Scott, you'd be really good at working with people with mental health problems and substance use disorders. And so I gave it a try, and I've had a career for many, many years helping people with serious mental illness and with addiction problems.
And what I love is, you know, when people think of doctors or, you know, medical specialties, we think more of the body, but most of our stuff starts up here. So to demystify all that happens up here, and I'm going to leave you with this question: is depression a choice, yes or no? When we come back, I'll give you the answer. Don't go away. Welcome back to Healthline. I'm Gregory Zarian, and before I dive into the cliffhanger as to whether or not depression is a choice, have you noticed that as of July 1st, Glendale Adventist Medical Center has a new look? We are now called Adventist Health Glendale, and we're part of a 20-hospital system in California, Oregon, Washington, and Hawaii. You've noticed the new name, but also notice its new look. Same heart, same mission. Gentlemen, we were talking about your specialties. Psychiatrist, you're in charge of behavioral health, and you have also been in charge of GADS, Glendale Adventist Alcohol and Drug Center, through Glendale Adventist Medical Center. Depression, is it a choice, yes or no, doctor?
Well, it's not, actually. It's a very well documented and diagnosable condition, and often is a choice how you're going to address it. But unfortunately, it's not a choice if you're going to have it or not. So the answer is no.
Go ahead, no, please, I'm sorry.
That's okay.
So if somebody wakes up and is not in a great mood, can you choose to be in a great mood, or does the depression, is it medical and take you down the rabbit hole, Scott?
Well, you know, when a person with depression wakes up, they have lost the ability to choose that capacity many of us have to set our mood or to change our mood. A person with depression might make the effort to do that, but they can't sustain it in an ongoing way. So they need help. And the help comes in a lot of different forms, but essentially the difference is a person who's not experiencing depression would be able to sustain an elevated mood or make a choice about how they're feeling during the course of a day.
Yeah, because most people talk, and I think it's becoming you know, an emotional pandemic that most people now are depressed and they're suffering from depression. Is it hereditary? Is it environment? Is it what you put into your system? Is it why are we depressed, doctor?
It's a combination of things. There is some percentage of hereditary factor, of course. Environment plays a big factor. Social economic situation plays a big factor. So it's an unfortunate storm. It comes to the same place, plays the genetic factor, environment factor, social economic situation, and then that affects person's brain, literally makes the chemical changes that, as Scott was pointing out, takes your choice away. When you have a clinical depression, meaning of you have a condition that dictates your feelings, the best determination or short way of answering what's the depression, it's a distorted reality. You think you are useless, you think you are hopeless.
You think that no one loves you.
No one loves you. But that's not reality. If you ask anybody around the person, they would say, this is a great person, he or she done this many things, but you don't feel it when you're depressed. So it stops being a choice, as we said, because of the chemical changes in your brain due to genetic, environmental, and social economic situations.
Scott, what are some of the signs and symptoms of depression? Because sometimes we all wake up and we all have bad moods. Sometimes, you know, it can be a couple days, sometimes we get a little depressed, and then a phone call or an event, a job, something snaps you out of it, and you're like, what just happened? Mm-hmm. What are the signs and symptoms of clinical depression?
Well, if I'd have to say it the simplest way, it would be functional impairment. So in other words, if a person's normally able to, say a young person, they're able to go to school and show up at a reasonable amount of their classes and do their homework, have some social interactions, have some fun outside of school, a person with depression would become functionally impaired. Their ability to show up at school would diminish. Their follow-through on homework, their ability to pay attention to things might diminish. Their sense of satisfaction about accomplishments might diminish. As Dr. Alexanian was saying, a person might be well loved and admired in their social setting at school or at home, but they wouldn't feel it. You know, so they'd be feeling empty and not accomplished. Mm-hmm. So an inability to sleep regularly, changes in diet, changes in mood, changes in ability to exercise, changes in attitude. All of those are functional impairments.
But you said somebody going to school. What are you talking age-wise? I mean, does depression start even in like young kids?
Yes, it does. The most common age of onset of depression is between 18 and 35. I would say 25 to 35, mood disorders in general. But there is an early onset depression. It starts, some patients would complain of depression remembering 6-7-year-old child.
But now, can't that start with environments at home? You know, mom and dad not getting along, fighting, yelling, screaming, shaming. Can all of that?
It's a contributing factor for sure.
Contributing, okay.
But can one become depressed just because of that factor? Probably not. Again, genetic factors should play and other factors should play. I guess what you're also bordering into, if there is a major abuse, continuous abuse, some sort, some type.
Thank you for addressing that.
Sure. Can that change person's chemical balance and therefore cause a clinical depression or other mental conditions? Absolutely, yes. It has to be a bit more sustained and more severe, and it will cause changes.
And in regards to if there is any type of abuse going on at your household, you need to talk to a family member that you feel safe with, because you're just a kid and you're just a child. How do you treat a young child, a young adult child, in regards to depression? Do you put them on medication? Do you change their diet? How do you treat depression?
May I?
Please.
First, you need to make a diagnosis. And throughout the questioning, when you had, I could not help but to notice that you're talking probably very similar, but two different conditions. One condition is an adjustment disorder with depression and anxiety, that the person having a hard time to adjust. You don't give a medication to that person. You help the person to adjust to the certain stressors or life stressors or job stresses, whatever family stressors.
Through conversation, through
conversation
therapy.
You don't medicate, because you can medicate that person as long as you want, but if the situation hasn't changed or the person doesn't know how to change the situation, the stressors will continue or medication will do nothing.
Okay.
And then there is a condition that calls clinical depression or depression that honestly, in my opinion, and a lot of my colleagues would agree with me, would be malpractice not to put them on a medication. But is therapy also important about that? Absolutely. The best results you get with the medication and the therapy.
Thank you, Doctor. More with Scott Robertson and Dr. Alexanian when we come back. Don't go away. Welcome back to Healthline, the conversations about behavioral health. And before we went to break, we were just wrapping up depression. Joining us is Dr. Lucas Alexanian and Scott Roberts from Glendale Venice Medical Center. When we're talking about depression, so giving someone medication, it basically just balances the serotonin in their head and makes them neutral, yes?
That's what we believe, yes.
What you believe. Scott?
Well, I mean, probably the reason, there's both a doctor and I have a master's in psychology, but I'm not a doctor and I don't prescribe medications. The doctor diagnoses, prescribes medication, and recommends treatment. And then the treatment team in the hospital, whom I represent,
Behavioral health.
in behavioral health and in the treatment of substance use disorders as well, we provide treatment, and that means a lot of different things, Greg. It means we attend to the person's diet. We attend to the other maybe co-occurring problems that they have. Maybe a person with serious mental illness has a drug or alcohol problem also that's unaddressed.
But let me look at that real quick.
Mm-hmm.
In regards to diet,
Mm-hmm.
how important is healthy diet to your mental health?
Huge, absolutely
Okay.
huge. Many people with mental illness and substance use disorders take things that elevate or change their mood. So the things that do that best are sugar and flour.
Got it.
So, people take sugar, flour, caffeine as ways to elevate their mood when they're feeling down. So oftentimes when people come into treatment, they've been sort of a soup, of all these different things that they can take that will elevate their mood. So they're reaching out for solutions by doing that. What we try to teach them in treatment is to avoid using those things certain times of day because it plays into sleep hygiene. So another thing that's helpful for people to recover is to sleep in an uninterrupted way for 6 or 8 or even a bit longer than that if you're young at night. And so to practice sleep hygiene, for example, is important to someone's recovery.
But what I love about sleep hygiene is when a child is born, parents teach the child how to sleep from night to the morning.
That's
And
right.
we as adults sometimes forget that. And I like that you were talking about, because earlier when I said health, I was thinking about eating really healthy.
Mm-hmm.
I wasn't contributing anything to the sugar, to the flour, to stuffing an emotion, stuffing a feeling, all of that.
That's right. So people can get involved in, eating food instead of having a feeling. They can get involved in what we call process addictions or, compulsive behaviors that elevate or change their mood again. So in treatment, what we try to do is help them to address and identify what other behaviors they've engaged in to cope with their mental illness or their substance use disorder, and help them to learn new behaviors to take the place of those. To try and just abstain or not do something isn't particularly healthy. So many of the things we engage in lead people to communicate in a validating and in a meaningful way. So a lot of what happens in group therapy settings.
Do you find, doctor, that most people, outside of it being hereditary, deal in behavioral health, don't have really strong communication skills?
I wouldn't say most people, but it's very common.
Okay.
The reason I would say, and I want to make sure that I'm very clear on this, that certain mental illnesses, including depression, you can have a perfect lifestyle, you can have absolute no addiction, you can have a good family, bring up in a family without abuse, yet end up having severe depression or severe mental condition. Would it be more contributory if your family and upbringing and stressors are more? Absolutely, that would be worse. But one thing I want to make it clear, that mental illness is often, unfortunately, just brings this ugly head regardless what you do. And people need to understand, and because oftentimes I see patients and they say, but I do well, I diet, I'm in a sport,
care of
I
myself.
am taking care of myself. Why I'm having panic attacks all the time? Why I'm having anxiety all the time? Why I'm having depression? And you go around and look around. Of course, always there is something to improve, but oftentimes it's just the illness. Although at the same time, we want to emphasize that poor and or stressful environmental factors are major issue, and upbringing and education and parenting and social economic and social environment is a major issue.
Who suffers more mental illness, men or women?
Depending what mental illness we're talking about. If we're talking about depression, twice as common with females compared with males.
Why is that?
Genetic
Okay.
and hormonal issues mostly.
And what are more of the male issues? What are more of the more mental issues for men?
Probably addiction.
Okay.
What Scott can
Scott,
present.
addiction more men than women?
Probably slightly more men than women. Certainly, schizophrenia is seen much more in men than in women.
Generally, 1% population of any nation, any country have a schizophrenia without any genetic inheritance. You add genetic inheritance, obviously numbers change, go up. You know what? I need to educate myself if it's any different sex-wise, but the age onset-wise is definitely different. Schizophrenia starts between 18 and 25. That's why a majority of men
Wow.
schizophrenics, you see uneducated, unfortunately, hasn't had a chance to finish the college. And again, I'm not talking about every single
Sure.
one, but majority, and hasn't got chance to get married or establish family. Compare when you have a female with schizophrenia that most common onset between 25 to 35 instead of 18 to 25. They are usually college educated, usually married, usually have better support system.
There's another factor, contributing, in our view, different view about men and women in mental health and in substance use disorders, and that is women access treatment less readily than men do.
Interesting.
Women more typically have single parent or head of household responsibilities, and as a result, childcare and work combine to work against many women seeking help when they need it. So what we notice in the substance use disorder programs is that women come in sicker. In other words, they've stayed out there, so to speak, with their disease longer than men have.
Because
Men are more readily the object of interventions, and women are less likely to enter treatment because of having less health insurance and because having more parental responsibilities than men do generally.
Wow. Ladies, ask for help. More with Scott Robertson and Dr. Alexanian when we come back. Don't go away. Welcome back to Healthline. I'm Gregory Zarin. The conversation's all about behavioral health. Joining us is Dr. Lucas Alexanian from Glendale Adventist Medical Center and Scott Robertson, who is in charge of behavioral health and has been participating with GADS, Glendale Adventist Alcoholic and Drug Services, for over 20 years?
26, yeah.
26 years. Gentlemen, when we think of mental health, what are some of them? We have depression. You were saying schizophrenia. What are some of the other ones? Doctor?
Well, there is a bipolar disorder, there is anxiety and panic attack, and these are the main commonly occurring conditions, but obviously there is obsessive compulsive disorder, there is a personality disorders, obviously drug-induced psychiatric conditions are very common also.
When you, most common now with depression, we talk a lot about bipolar. Why do you feel that we are being hit with more mental illness now? Scott?
I don't know that we're being hit with more mental illness
Because
as much as
more people are talking about
we
it.
might be more aware of it. And with all mental illness and with substance use disorders, they're really stigmatized. In other words, most of us grow up not really understanding that mental illness and substance use disorders are diseases that need treatment from doctors and healthcare professionals. And so as a result, we try to treat it in all kinds of other ways. We treat it through family interventions of an informal variety. We treat it with religion. We treat it with self-will. And we don't treat it. And so in more recent years, treatment has become more visible. And so we also have some celebrities who have come out, I can't think of names right
Full-blown
now,
come out with it.
but have come out with their mental illness and with their substance use disorders. Brave people. You know, when we say out loud that we've suffered from it ourselves, it makes it easier for the next person to admit that they have a problem. It's one of the reasons in our opening that I said that my family history and myself have struggled with these issues. And if we say it out loud, the stigma evaporates. And so as the stigma goes away, maybe people get more access to care.
You know, and I suffer from it, so it's saved my life. And what's amazing is that we have been able to have conversations about it, because it's true. The more you talk about it, the more you get rid of the big shame behind it.
That's right.
And the more you can just say, hey, you know what, you're not alone. Because a lot of people, excuse me, especially in this country now with where we're at, people dealing with sexuality, people dealing with identifying with who they are, there's so much suicide and depression and sadness. What do you say to all of that, doctor?
Well, get help. First of all, recognize that mental illness is as legitimate and as severe illness as any other disciplines in medicine, and get appropriate help. First step would be to recognize by the person and the family that there is a problem. Obviously, if you don't know there is a problem, you don't do anything about
But
it.
what's interesting too is because you and I are both Armenian, you know, it's such a closed, you don't talk about it. You know, and I think maybe we're talking about it more, but it's kind of like, no, it's okay. And I love that you said, get help, talk about it.
Right.
Have a conversation, because one conversation will save your life or change someone's life.
Right. Have an open mind about it, get to a right profession, and don't right away necessarily think, I'm not going to go to a psychiatrist because I don't want to take a medication. That's fine. Not every time they come to the psychiatrist we offer
You're getting a
medication.
pill.
Right. You get referral to the therapist, you get explained what's happening and directed in the right position, direction, so then you can get help appropriate. If it comes to the medication, you talk about it. Nothing is done against person's will. You talk about it, you educate the person, and you know what? Next time they have a bit more open mind about it. So understand what you're going through, communicate with the loved ones that you're going through, the loved ones not to get upset or hesitate, and support the person.
Because you're not doing anything wrong.
No.
You're just suffering again from mental illness. You know what I love is that a big mission at Glendale Adventist is addressing behavioral health. How do you two work together in regards to that?
Well, we work together every day, and Dr. Alexanian serves as our medical director on our inpatient psychiatric unit, which is 60 beds. Also as the medical director for our outpatient mental health and recovery services, where we have people on an outpatient basis, 20 to 30 people a day, 5 days of the week, who come either as a follow-up to an inpatient care episode, or like a person needs to, say they have depression after a disability or a surgery,
Sure.
or major depression, and they aren't going to school or work, they can come to the outpatient program, and in 4 to 6 weeks they get it back together to go back and function in their lives. That functional impairment we talked about earlier, the treatment addresses. So Dr. Alexanian and I work together with the teams that provide the direct services to the patients. Dr. Alexanian sees patients himself, of course, there and in his office.
And the administrative part is very, very important, particularly when Scott came to become an Adventist hospital's administrator. A lot of things change, but the key element is that, as he said, working as a team. Nurses are very educated. Nurses are knowing how to approach the patient. There is a very good support, recreational therapy, those kind of issues. And when you provide in a context with the medication, play a factor. And obviously making sure that hospital is safe, hospital has appropriate staffing, and we want the hospital to be safe environment. And Scott is very directly involved in that, and we had major changes recently.
Yeah, we
if
have.
you want to mention that.
Sure. I mean, we up to and including changing the name, Greg. You know, we years ago opened as a psychiatric institute. That's
remember
not
that.
exactly welcoming. So really, to reflect what our practice is currently, we changed our name to the Center for Behavioral Health and Recovery.
Love
And that was really a movement of the staff, you know, that they could acknowledge that many of the people that we work with in what was thought to be just the mental health setting have co-occurring substance use disorders. So, you know, The change in name is indicative of really what we do, and that is not just mental health, but recovery services as well.
Well, change in name, change in times, and giving it more of a conversation. We speak more, we share more, we talk more, and we're not alone. Scott, doctor, thank you so much for being here. So one thing that I do want to share with you, if you feel like there's something wrong, if you feel like you're depressed, if you feel that you're by yourself, you're on your own, if you're suicidal, all you have to do is reach out. Call someone, talk to a friend, get on the web. You have so many resources to say, hey, you know what, I'm in trouble. The most important thing you have is your honesty. So reach out, because you do not have to go through this alone. Glendale Venice Medical Center's mission is about you and your health. Find us on the web. Find us here at GAMC Healthline. I'm Gregory Zarin. Remember, the most important conversation you're going to have is about you and your health. So start talking about it. Have a great week, and we'll see you next time.